Good evening. My name is Nicholas Anthony Garcia, and this is my presentation. In this presentation, I will address the social and cultural needs of Black women in the United States. A historically marginalized, vulnerable group, Black women face distant challenges rooted in systemic racism and sexism affecting their health, education, and economic opportunities. These challenges necessitate a target and nuanced approach to bring out macro level change. Drawing upon frameworks learned in topics 4 and 6, I am to identify the community exam relevant data on their needs and highlight opportunities for improving their well being. This analysis will also incorporate insights gathered from within the community, frame the key social problems they face, and develop a working hypothesis to address these issues effectively. By understanding their needs and strengths, we can lay the groundwork for equitable solutions that promote long term empowerment and social justice. Framework Task 1, Topic 4, Identify the community. The community of focus is the analysis of Black women in the United States, a diverse yet distinct group defined by their interesting identities of race and gender. Geographically, Black women are concentrated in urban hubs such as Atlanta, Chicago, and New York, but they are also present in rural and suburban areas across the country. These women come from various social economical backgrounds, ranging from those in low income brackets to middle class professionals. Despite their diversity, they share a common history of resilience and resistance shaped by systemic inequities. Black women cultural identity is deeply rooted in African heritage, slavery, segregation, and the civil rights movement. Historically, Black women played pivotal roles in their families and communities, often serving as caregivers, activists, and culture preservers. The community's culture emphasizes strong family ties, mutual support networks, and spiritual beliefs, often expressed through African American churches. For example, Black women have long turned to church based organizations for emotional support, financial assistance, and advocacy for social change. The collective cultural identity of Black women is further reinforced by their shared experiences of discrimination as well as their historical events, arts, and activism. Black women are often situated at the intersection of racism, sexism, facing unique challenges that stem from dual oppression. This intersectionally influences their experience in various domains, including healthcare, education, and employment. For instance, Black women are more likely to encounter implicit bias in healthcare settings, which contribute to disparities in health outcomes. Similarly, systemic barriers in education and the labor market perpetrate economic inequities that disproportionately affect Black women. Despite these challenges, the resilience of Black women remains a defining characteristic of the community. Through grassroots organization, political leadership, and cultural expression, Black women continue to advocate for systemic change and social justice. Framework Task 2, Topic 4, Data. To fully understand the needs of Black women, it is crucial to examine the data that highlights the systemic challenges they face. One of the most alarming disparities is in healthcare outcomes. According to the Center for Disease Control and Prevention, Black women are 3 to 4 times more likely to die from pregnancy related complications than white women. This disparity is attributed to factors such as inadequate access to quality health care, implicit bias among medical professionals, and the chronic stress caused by systemic racism. For example, Serena Williams, a globally recognized athlete, publicly shared her near fatal experience with childbirth complications, shedding light on how even wealth and fame does not shield Black women from these risks. Economically, Black women face significant barriers to financial stability. The Institute for Women's Policy Research reports that Black women earn just 63 cents for every dollar earned by white or non Hispanic men. This wage gap limits their access to essential resources such as healthcare, education, and housing, perpetuating cycles of poverty and economic insecurity. Compounded by systemic racism and economic challenges, have long-term effects on Black women's quality of life. For instance, lower earnings reduce Black women's ability to save for retirement or invest in wealth building opportunities, further exacerbating the racial wealth gap. Education is another crucial area of concern. The National Center for Education Statistics shows that while Black women have made significant strides in higher education, often enrolling at higher rates than Black men, they are disproportionately burdened by student loan debt. On average, Black women carry 22% more debt than their white counterparts, which undermines their financial stability and limits their ability to achieve upward mobility. This debt burden reflects broader systemic inequities such as racial wage gap and discriminatory lending practices that hinder Black women's progress. In addition to these challenges, mental health disparities among Black women warrant attention. According to the American Psychological Association, Black women are less likely than white women to receive treatment for mental health conditions such as depression and anxiety. This disparity is due to factors such as stigma, lack of access to culturally competent care, and financial barriers. For example, many Black women report feeling dismissed or misunderstood by their healthcare providers, which discourage them from seeking help. Addressing these disparities requires systemic reform that prioritize equity, culture competence, and accessibility to mental health care. Framework 3, Topic 4, Community Assets. Despite the systemic challenge they face, Black women possess significant strengths and resources that contribute to their resilience and capacity for social change. One of the most notable assets within Black communities is the strength of the family and social networks. Black women often rely on extended family, friends, and community organizations for emotional support, childcare, and financial assistance. These networks play a vital role in mitigating the effects of systemic barriers and fostering a sense of collective solidarity. Cultural identity is another key asset for Black women. Rooted in African traditions and shaped by the history of the African American experience, this identity serves as a source of pride, resilience, and empowerment. Black women's cultural expressions, including art, music, literature, activism, reflect their ability to navigate and resist systemic oppression. For example, Black women artists such as Maya Angola, Nina Simone have used their work to celebrate Black culture and advocate for social justice, inspiring generations of activists and leaders. Black women's leadership is a significant strength within the community. From grassroots organizers to elected officials, Black women have been at the forefront of movements for social change. Organizations such as Black Women's Health Imperative and the National Coalition of 100 Black Women address critical issues such as healthcare disparities, economic inequalities, and political underrepresentation. These organizations leverage the leadership and expertise of Black women to advocate for policies they promote equity and justice. The power structure within the Black community is multifaceted, with both formal and informal leaders playing critical roles. Formal leaders such as Vice President Kamala Harris and Congresswoman Anaya Press use their positions to influence policies that benefit Black women and their marginalized groups. On a local level, informal leaders, including community organizers, activists, and faith based leaders, work to address immediate needs and mobilize grassroots efforts for systemic change. Together, these leaders exemplify the resilience and agency of Black women in the face of systemic challenges. In addition to their leadership roles, Black women's activism has been instrumental in shaping social policy. For example, Black women played a pivotal role in the 2020 presidential election, mobilizing voters and advocating for issues such as healthcare access, racial justice, and economic equality. The activism underscores the community's commitment to creating a more just and equitable society. Social policy plays a crucial role in shaping the well being of Black women. Policies such as Medicare expansion, affordable housing initiatives, and wage equity laws directly impact Black women accessing to essential resources and services. However, systemic barriers often limit the effectiveness of these policies. For example, restrictive Medicare eligibility requirements disproportionately exclude low income Black women from accessing health care. Addressing these barriers requires targeted advocacy and policy reform that prioritize equity and inclusion. Framework Task 4, Topic 4, Structure and Capacity. Black women's access to resources is shaped by both formal and informal structures within their community. each playing a critical role to determine their overall well being. Understanding how these structures interact is key to addressing health disparities and improving the lives of Black women. Formal resources, including a broad array of professional services and institutions such as healthcare providers, nonprofit organizations, and community health centers that are designed to offer support in key areas like mental health, reproductive health, chronic disease management, and maternal health. These resources are essential for providing specialized care, supporting long term health conditions, and interventions that improve quality of life. However, their, despite their importance, formal resources are often unfounded and their availability is constrained by geographical and financial factors. For example, in many low income neighborhoods or rural areas, access to well equipped health facilities is limited, meaning Black women often have to travel long distances to access care. In some cases, these areas may lack qualified healthcare professionals who are sensitive to the unique culture and medical needs of Black women. Moreover, economic constraints can limit access to services, high costs of insurance, copays, and out of pocket expenses prevent many Black women from seeking the necessary care. Even when healthcare facilities are available, these resources are often strained by high demand and insufficient funding, resulting in long wait times or reproduced quality of care. Furthermore, Black women often face implicit bias in healthcare settings, which can lead to misdiagnosis, a lack of trust, and a suboptimal treatment. These issues are particularly pronounced in maternal health, where Black women face disproportionately high maternal mortality rates. The complex interaction of underfunded formal systems, systemic racism, and social economic disparities contribute to the challenge Black women face in accessing quality health care. Informal resources. While formal resources play a crucial role, informal community networks can often provide the most immediate and trusted support. These formal resources are embedded within the social fabric of communities that include family, friends, church organizations, and other community based groups. These networks offer emotional, financial, and logistical support in ways that formal resources cannot always provide. One of the key features of informal resources is that social capital they provide bonds of trust, shared cultural norms, and mutual care that can be mobilized in times of need. For instance, many family members often serve as primary caregivers, helping with childcare, offering financial support, or assisting with transportation to medical appointments. In many cases, these support systems provide not only practical help, but also emotional encouragement, such as offering comfort during difficult health challenges or moments of racial injustice. For Black women who may face both health challenges and added stress of systemic racism, this emotional and social support is invaluable. Church based organizations, in particular, offer often serve as community hubs for Black women. Churches are not only places of worship, but also spaces for socialization, mutual aid, and advocacy. Many Black women rely on church communities for spiritual support, but churches also offer practical resources such as food pantries or emergency financial assistance or transportation to medical appointments. These networks are often more accessible and culturally resistant than formal healthcare institutions, providing a sense of belonging and solidarity in times of personal family crisis. Furthermore, informal systems often play a significant role in filling the gaps left by formal institutions. When healthcare services are inadequate or inaccessible, community networks can help coordinate care, offer advice on how to navigate the healthcare system, or advocate on behalf of the individuals. This support system, although informal, can be highly effective in fostering resilience and mitigating some of the adverse effects of structural inequalities. Framework Task 1, Topic 6, Gathering Information from Persons Within the Community. To better understand the needs and expressions of Black women, it is essential to gather direct input from the community, engaging with Black women through interviews, focus groups, or surveys provided valuable qualitative data that can reveal insights to specific challenges they face, as well as kinds of support they seek. These conversations allow Black women to share their lived experience, offering deeper understanding of their health concerns, social needs, and the barriers they encounter in accessing resources. For instance, interviewing Black women may be highly the importance of culturally competent healthcare. Black women may express a need for healthcare providers who not only understand their unique medical risks they face, such as higher rates of hypertension, maternal mortality, and diabetes, but also acknowledge the social detriments of health, such as experience of racial discrimination, social economic status, and access to education, that they may also emphasize the need for more health professionals who are from similar racial or cultural backgrounds, as this can help bridge the trust gap and improve care delivery. Focus groups of surveys can also reveal that Black women seek more holistic approaches to health that consider both physical and mental well-being. For example, Black women face disproportionate burden of stress due to racial discrimination, which can manifest as chronic anxiety, depression, or physical health conditions. This stress is often compounded by economic insecurity, caregiving responsibilities, and the absence of supportive policies for work-life balance. Therefore, many Black women may call for the healthcare services. They not only address physical ailments, but also provide mental health support and culturally sensitive counseling. Moreover, such communities' engagement helps identify gaps in service provisions and areas for improvement in both formal and informal systems. By listening directly to needs and concerns of Black women, health providers, policymakers, and community leaders can design more effective inclusion and culturally competent interventions that reflect the diverse realities of Black women's experience. Framework, Task 2, Topic 6, Selection of Social Problems. One process social problem that disproportionately impacts Black women is maternal mortality. Studies show that Black women are significantly higher risk of dying during or after childbirth compared to women from other racial groups. According to a report by the American College of Obstetricians and Gynecologists, Black women in the U.S. face 3 to 4 times the risk of maternal death, often due to factors like inadequate health care, implicit bias, and social economic status. This problem is rooted in systemic inequalities that affects healthcare access, quality, and affordability. Addressing this issue requires improving healthcare policies, enhancing cultural competencies among healthcare providers, and creating a stronger community healthcare system. Framework Task 3, Topic 6: Frame the social problem and develop a working hypothesis. The problem of maternal mortality among Black women can be framed within the larger context of healthcare inadequacy. A working hypothesis could be the higher maternal mortality rate among Black women in the United States is primarily driven by systemic racism in healthcare, including lack of access to quality care, implicit bias among medical professionals, and social economic barriers. This hypothesis will be tested by examining existing studies, conducting interviews with healthcare professionals, and gathering qualitative data from Black women who have experienced or been affected by maternal health issues. This approach will help identify specific areas where change is most needed. In conclusion, addressing the needs of Black women in the United States requires a thorough understanding of the community's cultural, social, and economic context. Through both economic perspectives, we can better identify the challenges Black women face, such as healthcare disparities, economic inequalities, and social discrimination. The strength and resilience of the Black community, particularly Black women, provide a solid foundation for positive change. As social workers, we must advocate for systemic change that addresses these issues and create a more equitable society for all. Thank you. This is the end of my presentation.